Welcome back. The organisation Section 27 has launched a successful urgent court application on behalf of a pregnant teenager who had been denied access to abortion services as a public healthcare facility in Gauteng because of her age. The young woman had made several attempts to access an abortion but was repeatedly turned down. By law, a minor should be able to access the care that she needs. Khanyisa Mapipa is an attorney with Section 27. Khanyisa, good afternoon to you. What happened here? How old is this young girl?
Good afternoon, Stephen, and thank you for having us. Unfortunately, because of the court order that was issued to protect the minor's identity, we aren't at liberty to say how old she exactly is, but what we can say is that she is under the age of consent.
Okay, so she's under the age of 16. As I understand it, the law has always said that from the age of 14, I think it was, a woman would be able to get an abortion. What happened here? Why would someone be turned down in this case if that's the law?
The law actually says a woman under the over the age of 12, so a woman, a girl, or a person who is able to fall pregnant over the age of 12 is entitled to termination of pregnancy services. So that is the reading of the Choice and Termination of Pregnancy Act together with the Children's Act. What we often find in the cases that we deal with, which is similar to this one of this nature, is that healthcare facilities tend to obstruct access to abortion services because of the individual service provider or healthcare provider's beliefs, whether they believe that the minor ought to have their parents there, or they believe that abortion for some reason is immoral. They tend then to obstruct the access to service.
Was there any legitimate medical reason why the procedure could not be carried out here?
There was not. Initially, they had scanned the minor and had said that there was a complication with her pregnancy which disqualified her. The particular complication I also cannot, I'm not at liberty to say, because with that, someone could draw that it was her. But when we then enlisted expert evidence, we were satisfied that the complication that the facility said they noted did not disqualify her. As a matter of fact, Section 44.2 of the National Healthcare Act, read with the guidelines to the Choice of Termination of Pregnancy Act, say that if a primary healthcare facility or any other facility for that matter cannot perform a termination of pregnancy or provide any healthcare services, they are duty-bound to refer the patient to a facility that can provide the service. So in this instance, what ought to have happened is that the minor ought to have been referred to an obstetrician or a gynecologist within the public healthcare system who would be able to perform the termination of pregnancy given the complications noted.
So the thing about these cases is that unfortunately the clock ticks. There is actually a deadline. I think it's 20 weeks. You have to have had the abortion at 20 weeks. Afterwards it becomes illegal. Is there still time here? Because I can just imagine the kind of pressure that's been put on this.
So, Stephen, the actual deadline is 20 weeks, 6 days. The Act says under 2.1b, the second trimester abortion can be done within the 13th week, from the 13th week to the 20th week, and that is interpreted as 20 weeks, 6 days. And so when the minor approached us, she was sitting at what the experts estimate was 20 weeks, 3 days. By the time we went to court, she was at 20 weeks. By the time she approached us, she was entering her 20th week. By the time we went to court, she was 20 weeks, 3 days. And so when she attended the healthcare facility, they estimated that she was 20 weeks, 5 days. And so just at the cutoff. And I am I am happy to announce that she has managed to obtain the termination of pregnancy through the court order, and is now back home and happy and healthy.
Sure. Such a complicated story, so much around the law, but also something, as you say, that's happening in many cases around the country. Khanyisa Mapipa, thank you. He's an attorney at Section 27.